So today I'll be demonstrating how to insert and remove an indwelling urinary catheter. I will start by confirming the physician's order. I will identify my patient with 2 patient identifiers. I will perform hand hygiene. I will make sure that the room is well lit so that I can see to perform my procedure properly. I will ask my patient if they're allergic to anything, especially iodine or latex in particular. I will make sure to provide privacy for my patient, and then I will make sure that the bed is raised to a proper working height for me to perform the procedure. So I have made sure that I'm to the right of my prop because I am right-handed. I would position my patient into the supine position with the knees flexed and the legs apart. I will position my catheter tray between the patient's legs. So when I open my catheter tray, I'm going to open away from me, side to side, and then towards me. I will take my sterile gloves out of the package and put on my sterile gloves. Alright, now that I have my sterile gloves on, I would take my drapes and open them up and position them correctly under my patient, not to contaminate my field, but I want to provide myself more room for a sterile field to be able to work. You would take your drape here with the hole in it and place it over the perineal area of the patient. So I would make sure everything is positioned in an easier way for me to access, making sure that I do not break the sterile field. So I will open my antimicrobial swabs, remove them from the package, and set them on my tray. I will open my lube, squirt some out on the tray, and then I will take my syringe, go ahead and attach it to my catheter tubing. So then I will take my non-dominant hand and spread apart the labia minora. Once I spread it apart and begin to clean it, I cannot let it close or touch because it will just recontaminate. So I will take my swab and go from top to bottom on the side furthest from me, take my swab and go around and discard. I do not want it to go directly over because it can contaminate my field. Then I will go to the side closest to me, come back around, and then go right down the middle, top to bottom, back around, and discard those. While it's still spread apart, I will grab my tubing about 3 inches down. I will lubricate it, ask my patient to breathe deeply and remain calm as I get ready to insert. I'm going to insert it about 2 inches until I see urine, and I see the urine, so I will insert another 1 to 2 inches and then I will anchor it about 2 inches away from the meatus and begin to inflate my balloon. I'm going to keep some pressure on my plunger so that none of the liquid comes back out. Once it is all in there, I'm going to gently tug on my tubing to make sure it does not come out, and it doesn't, so I will remove my syringe. I would attach the tubing to my patient's thigh with an attachment device. I would secure the bag to the bed frame. I would remove my gloves and perform hand hygiene. I would then document my procedure. I would document the time of the procedure, how much urine and what color it was, how much water I inflated the balloon with, how my patient tolerated the procedure, and anything else that would be considered crucial to document. So to remove the catheter, I would put on my sterile gloves, my clean gloves. You do not have to have sterile gloves to remove. So I've put on my clean gloves. I will still identify my patient, perform hand hygiene, confirm the physician's order to remove the catheter. I will position the patient in the same position that I would to insert the catheter. I will remove the adhesive device from the patient's leg to get rid of that so that I can take it out. I will take a syringe and insert it into the tubing. And you do not pull on the plunger. You simply let the fluid flow back into the syringe. It happens kind of slowly. Takes a minute. Now that I have 10 milliliters back in my syringe, I'm going to disconnect the syringe, have the patient inhale and exhale deeply. I'm going to grab the tubing, and on exhale, I'm going to slowly remove the catheter. I will discard into the trash, remove my gloves, and document the procedure.